Hey again, Nick Troiano here. This past weekend, I had an opportunity to visit Dartmouth College for a policy summit that focused on education and healthcare. Some of the nation's top experts convened, including Dr. Albert Mulley and Dr. Elliot Fisher. Dr. Mulley provided a succinct but scary summary of the healthcare system in the United States. That is, a system that wastes too much on care that sometimes does more harm than good for patients, and largely sticks future generations with the tab. Now, don't take his word for it, just consider these three facts. First, in 2012, the Institute of Medicine found that upwards of 30% of healthcare spending in 2009 was dedicated to unnecessary or poorly delivered services. That amounted to over $750 billion. Second, at least 18 studies have found a link between higher healthcare spending and worse healthcare outcomes. In fact, just this week, the Inspector General of the Department of Health and Human Services released a report that found a third of patients admitted to skilled nursing facilities were harmed during their stay, 60% of whom had to be readmitted to the hospital. Third, a large part of this wasteful and harmful spending is coming from the government through programs like Medicare and Medicaid, which are among the drivers of our long-term national debt. In 2010, the Urban Institute found that the average wage-earning couple turning 65 could expect to receive about $387,000 in lifetime benefits from Medicare, more than 3 times the amount that that couple will have paid into that program. The balance is taken from general revenues, a large part of which is simply borrowed from future generations. America deserves better than a healthcare system that wastes too much and harms too many. The good news is that there are new innovative models of healthcare delivery that can reduce waste, cut costs, and improve healthcare outcomes. Dr. Elliot Fisher, for example, has led the development of accountable care organizations, or ACOs. Rather than using a fee-for-service model of delivery, which incentivizes extra care and fragments healthcare delivery, ACOs encourage hospitals and physicians to coordinate their care and share in any of the cost savings gained while improving patient outcomes. There are now more than 400 ACOs across the country, and the federal government can do more to expand them. For example, federal legislation can be passed to encourage risk-based contracting in Medicare, which would partially pay providers based on the value of their care rather than the volume of their care. Likewise, the federal government can reduce payments for fee-for-service delivery after a set period of time in order to accelerate a transition to the ACO model. Well, until next time, I welcome your thoughts on the issue of healthcare in the comments section below and hope to see you again next week.